Hi, this is Elise, Devin, and Rachel, and we're going to talk about cocaine addiction. Coca, also known as erythrocylin coca, has been used for over 4,000 years as a medicine and stimulant. The leaves' natural habitat is the Andes mountain range. The locals would chew up the leaves to speed up their breathing in order to have enough oxygen in the high altitude. Coca was starting to be introduced into Western medicine in the 19th century when Westerners began to explore those regions to find new medicines. At first it was believed it was a safe stimulant and was commonly used therapeutically for nerves. About 30 years after its introduction, coca was discovered to be an addictive, dangerous drug. Cocaine reemerged as a popular drug in the 1970s. As the price dropped, over 6 million Americans were using it regularly in the 1980s. It appeared that there were no serious consequences to using cocaine until celebrities and athletes began to overdose. This led to cocaine's reputation of being highly addictive and dangerous once again. Nowadays, Colombia produces between 70 and 80% of the world's cocaine from locally grown coca plants and from those imported from the cocaine base in Peru and Bolivia. In the late 1800s, cocaine was used as the primary ingredient in Coca-Cola, helping to grow its popularity due to its addictive properties. Once the dangers of cocaine were discovered in 1903, cocaine was removed from the ingredients of the soda. Now, the decoconized version of the extract of the coca leaves is made in the U.S. and is used for Coca-Cola flavoring. The crude cocaine that is left over is sent to pharmaceutical companies and used in medications. Cocaine can be snorted, swallowed, injected, or smoked. Serious damage to the nasal mucous membranes can result from habitual snorting. The street drug comes in the form of a white powder, cocaine hydrochloride. The hydrochloride salt and the cutting agents are removed to create the pure base product called freebase. Freebase is smoked and reaches the brain in seconds. Crack cocaine, also called rock, is a form of freebase that comes in small lumps and makes a crackling sound when heated, hence the name crack cocaine. Crack cocaine intensifies the effects of cocaine and is considered to be more highly and more quickly addictive than snorted cocaine. It causes a very abrupt increase in heart rate and blood pressure that can lead to heart attack and stroke, even in young people with no history of vascular disease, sometimes the first time the drug is used. It also crosses the placental barrier, meaning that babies born to crack-addicted mothers are prone to going through withdrawal and are at a higher risk of stroke, cerebral palsy, and other birth defects.
The neural system that cocaine affects the most is called the ventral tegmental area, VTA, located in the midbrain. VTA nerve fibers extend to the nucleus accumbens, a brain region that is largely associated with response to rewards. Rewards increase levels of the neurotransmitter dopamine, which increases activity in the nucleus accumbens. Dopamine transporters are responsible for the process of dopamine reuptake. Cocaine blocks the dopamine transporters and inhibits them from being able to bring excess dopamine back to presynaptic neuron. This creates a buildup of dopamine in the synapse, causing more dopamine to bind to dopamine receptors of the postsynaptic neuron. This process results in the pleasurable feeling that cocaine users get, causing addiction. When cocaine is inhaled through the nose, it enters the sinus cavity and goes through the mucous membranes at about 100 miles per hour. It is then absorbed through the membranes into small capillaries. After absorption, the capillaries constrict and deprive the tissues of blood and oxygen. The capillaries then lead to bigger veins and arteries that direct the cocaine in the blood to the heart. The heart begins to beat faster because the cocaine inhibits the reuptake of another neurotransmitter called norepinephrine, which increases blood pressure. This process distributes the cocaine throughout the body into the brain. Cocaine has the ability to block voltage-gated sodium channels in the axons of nerve cells, which create action potentials. Because cocaine has the ability of inhibiting nerve signal conduction, if it is used locally on tissue, cocaine can act as a local anesthetic. Cocaine use causes an intense, short high followed by severe edginess and craving for more. Usually, people don't eat or sleep properly, have heightened heart rate and convulsions, as well as the feeling of anger, anxiousness, and uneasiness. Users often have an increased heart attack and stroke risk. Other short-term effects are dilated pupils, nausea, hallucinations, panic, and paranoia. When tolerance increases, the addict needs a larger quantity to get a similar high. Long-term daily use can create a loss of appetite and sleep deprivation. Somebody can experience an intense hallucination or depression could follow the high, which might make the user do anything for the drug like murder. If cocaine can't be obtained, some addicts even commit suicide. Other long-term effects are hyperstimulation, seizure, and contracted blood vessels. No FDA-approved drugs or medications are currently available to help treat cocaine addiction, but researchers are continuously working towards discovering safe and effective medications to use. Certain medications that are used for other diseases, like vigabatrin for epilepsy, modafinil for sleep apnea and narcolepsy, or disulfiram for alcoholism, have been reported to lessen the use of cocaine in certain clinical trials. Disulfiram is noted to work the most efficiently. Currently, researchers are working on a potential vaccine that inhibits cocaine entry into the brain, and they hope this could help with preventing future relapses.
Behavioral therapy has often been the most efficient approach in regard to helping cocaine addicts. Contingency management or motivational incentives have helped with initial abstinence and helps patients remain in treatment. This method uses a voucher/prize-based system and offers rewards or incentives for those who hold back from using cocaine. If urine tests come back drug-free, the patients receive points that can be traded for things that promote healthy living. Example, gym memberships, dinners at a favorite restaurant, and such. Cognitive behavioral therapy, or CBT, is an approach that is most efficient in preventing relapse, concentrated on helping addicts stay abstinent from cocaine as well as other harmful substances. This therapy aids addicts with recognizing, avoiding, and coping with situations in which they would use cocaine, avoid them, and cope with problems that result from usage. CBT is also compatible with many of the other behavioral treatments. TC is therapeutic communities, and there are residential programs which usually have patients stay for 6 to 12 months. The other addicts in the program are used as active elements of the therapy as they work towards sobriety. These communities can consist of on-site vocational rehabilitation, which is like talking to therapists and other recovering addicts, and additional services. TCs concentrate on helping the addicts re-enter society with the hopes of staying clean. Community-based recovery groups can be helpful in remaining abstinent from cocaine use. One example is Cocaine Anonymous, which is a 12-step program in which people share and talk about past cocaine experiences, discuss common problems, and offer and receive support.